All right, guys. So today we're going to be talking about injections. So a lot of times when somebody's having knee pain, hip pain, or shoulder pain, they may be starting to turn their focus or their attention or start considering getting an injection, or they may have their physician recommending them to get an injection as well. And so I want to set the record straight on when you should be considering getting an injection and when there might be a better alternative to look at instead. And so I want to start off by telling you, sharing with you guys what exactly is an injection doing physiologically to the human body, so you guys understand how they may help. And so when you get an injection, specifically a steroid injection, what it's doing is they're injecting that into the tissue, whether that's muscular, tendon, or ligamentous. And so when they inject that, when they do the steroid injection, what's happening is the purpose of it is to decrease inflammation within that structure. When inflammation is decreased, pain also decreases as well, because pain is a byproduct of inflammation. Okay, so if we can get rid of inflammation, pain goes away. Okay, so that's physiologically what's going on when somebody gets a steroid injection into those structures or those tissues as well. Okay, so I want to talk about another important topic here is when should you be considering it and when shouldn't you be considering it. So first and foremost is it should not be your first course of action if you're experiencing pain. So for example, let's say you're having knee pain and you go and see your physician, and first thing they recommend is getting an injection. That to me is a pretty significant red flag. Okay, injections are a relatively invasive procedure. Okay, there's a lot of other conservative options that should be exhausted first before turning towards injection. So if you go see your physician and the first thing they recommend is getting injection, get a second opinion. Go to another physician, go see a physical therapist, chiropractor, and see if there's other measures that are more conservative that you can take first before getting an injection. Okay, so another thing too is you're probably wondering well, when is a good time to get it then? So if I don't usually recommend getting injections unless a patient comes in for physical therapy and we're having a really hard time with being able to implement exercises or progress exercises because the patient is having too much inflammation, having way too much pain, and they're not able to tolerate certain exercises. Okay. However, that's very rare cases because there's such a large variety of exercises that there's so many modifications that we can make to offload and make it so there's a regression or an up, or making it harder or making it easier based on what the patient's able to tolerate. Okay, but on the rare cases that it's not, what I do is I'll have a patient go get an injection to help decrease some of this inflammation that they're having and decrease the pain, so that we have a window of opportunity to start implementing exercises that we wouldn't have otherwise possibly been able to, due to the increased inflammation and the increase in pain that the patient may be experiencing as well. Okay, so the thing with injections though is we have a 4 to 6 week window, and usually, and again, that's just traditional. There's some people that don't feel any relief whatsoever getting an injection, to some patients on the other end of the spectrum getting complete relief and it never coming back. However, both of those, that far end spectrum of it treating everything and never coming back is very, very rare. Okay, and the reason for that is because an injection really isn't treating the root issue of what's going on. Okay, an injection doesn't create the movement patterns or the imbalances of strength or range of motion. It's not correcting any of that. All it's doing is decreasing inflammation within the tissues and decreasing the pain there. And so if you keep, most of the time, the fact that the tissue that's inflamed, rarely ever is it actually responsible for the pain that you're experiencing. There's an underlying root issue that's going on that's causing this tissue to become inflamed. Okay, so a lot of times when we get an injection, it's kind of just a mask. It's just kind of masking that pain, or just band-aid to the actual underlying issue. Okay, so what happens is if you get an injection, it'll decrease that inflammation. But if during that time that you're recovering, if you're not implementing exercise and correcting the imbalances that cause this issue in the first place, it's going to come back. All right, so it's super important after you get an injection to make sure that you continue or start up physical therapy to address those root issues so this doesn't come back. Okay. So when a patient goes get an injection, we have that about 4 to 6 weeks, again, on average, that we have to work with before that injection starts wearing off. So it's imperative during those 4 to 6 weeks that we start implementing exercise to correct that root issue. So by the time that the injection starts wearing off, that issue, the underlying issue solved, and that pain doesn't come back as well. Okay, because the big myth, and one thing I really want to drive home today, is to let you guys know that getting an injection isn't the end all be all. It does not solve the root issue, and it's just really a band-aid to the issue. Okay, and so it's very, very important to solve the root issue elsewhere. That's usually through physical therapy and correcting those imbalances and whatnot too. Okay, one other pet peeve of mine is when a patient goes in to see a physician, and the first thing they want, the physician, first thing they want to do is do the injection. And they want to do, and one of the biggest pet peeves is when a physician wants to do injection to kind of figure out what's going on. They use it as a diagnostic tool sometimes. And in my opinion, that's not the right way to go about things. Okay. So if a physician's kind of confused about what's going on or what structure is actually the problem there, what they'll do is they'll do an injection into the tissue that they think might be the issue. And if it feels better, like, okay, great, now we know what's going on. If not, well, at least we know that that's not the issue. Well, in my opinion, there's a lot better ways to decipher what is the actual root issue of what's going on, rather than having to stick somebody with a needle to figure it out and just kind of randomly guessing on what the problem is. There's so many orthopedic tests and measurements that we can do when measuring strength, measuring range of motion, and seeing how somebody moves, that can give us much better answers overall, and where we don't have to guess by sticking a needle in somebody, right? So if the first thing that your physician wants to do is to stick you with a needle for one reason or another, because they feel like they know what's going on, or if they want to use it as a diagnostic, either way, that should not be the first course of action. Make sure you get a second opinion of that as well. Okay. So there's also risk versus reward too with getting injections. It's not all hunky dory, like, oh, it doesn't hurt there's no reason that we shouldn't just give an injection and try. Because if you actually, over time, if you get too many injections into that area, like I said, usually it wears off 4 to 6 weeks. So if all somebody does is get an injection and doesn't do anything for it, 9 times out of 10, that's coming back. Okay. And so what the patient wants to do is like, okay, or the person wants to do is say, like, I responded really well to the injection. I had no pain for 4 to 6 weeks. I want to get another one. Okay. Well, the problem with that is if you get too many of these injections in too short of a window of time frame, what happens is that tissue actually starts breaking down and becomes weaker. So if you have a tissue that's weak, okay, and you haven't corrected the biomechanical misalignments or the strength deficits or the range of motion deficits or how you're moving, if you haven't corrected the underlying issue, now you're working with tissue that's even weaker. And so it's going to put you at an increased risk for sustaining it, to making this injury even worse, okay, and more chronic as well. Okay. So don't get in the rut of just turning to injections and that's it. Okay. Too many times I see people end up with chronic issues because of it as well. Okay. So hopefully this kind of gave you guys an insight into when injections are beneficial and when it might be better to look at a different alternative for the time being. The big takeaway here is it should not be the first course of action. You should be getting physical therapy first to try and treat the root issue and build up from there. Okay. So again, hope this is beneficial. If you guys have any questions, let me know and I'm happy to help. All right. Thanks, guys.